All right. Good morning. I'm gonna if do you mind if I record? I'm gonna send the video to my to my
Siya
brother.
po.
Oh no, I'm gonna just record our conversation.
Yeah, sure.
Yeah, I
You can stay out here po.
Okay, okay.
So right now po, what we've been addressing is mostly his breathing and of course the acid that's
I'm a nurse practitioner also,
Oh,
so
yeah.
you could
Okay.
speak freely.
So hindi po kayo yung nakausap ko over the phone?
Yeah, yeah. So I was the
tayo.
original one when he was really declining, and he
Oh,
was
no,
in
okay, so-
he was in DIC.
Yes.
You guys
So
were
we got-
doing
we- yeah,
the acid, and then we knew.
Tayo yung nagkausap na?
Yeah,
Okay,
yeah.
good. So, moving after that, we were
Yeah.
able to control the bleeding. Remember, we talked about the bronchoscopy?
Yeah.
So, we had it done, and
They were able to do it
control-
with some type of tamponade or something, right? Yeah.
Yeah, so we were able to fix the bleeding, and we
Okay.
were able to transfuse. And so far, we've just been having some bleeding when they suction. It wasn't like how it was before.
Before, no, it was
that
profuse.
yes,
Yeah,
perfused.
it was
So
like
it's
I was
better
seeing
now.
the canister
Yes.
was full.
So
of it,
it's
yeah.
better now, but of course there's still some bleeding there. It's most likely because of the frequency of suctioning and because of the post surgery around the tracheostomy. But it's fine now. It's much better. We're still
Platelets
transfusing.
are
They're
at
a little
80.
better, yes, but not normal. So
Okay,
it's still low. But otherwise, we've been able to address the problems. The
The
lung problems
DIC
is
the
not-
DIC level.
More, yes, it's no longer in DIC.
Okay,
It's no
cool.
longer in DIC
Perfect.
now. But one of the things that's starting to creep up now is the problem with the lungs.
Yeah.
Yes.
yeah.
So he wasn't doing so well in another setting with the ventilator, so we had to put him on the adaptive ventilator setting so that
Okay.
the machine would go with whatever his lungs were willing to take in.
So that's why because my brother is concerned. He's a respiratory therapist about how high the PEEP was.
Yes.
The pressures. Yeah.
Yes, but the reason why his peeps have been high, the pressures have been high, is because his lungs are pretty stiff.
Yeah.
So if you can see the C-stat, the static compliance is now at around 8 to 10.
Okay.
Hasn't gone up higher than 20. In the past few days, when I was seeing him, the lungs were a little better over those past few days. We would have static compliances of about 30, 40.
So there
but
is
they
some
dropped.
there's some improvement in that.
No,
No, it's
that
not.
is better.
Oh,
So it's a little worse.
That's worse. Okay.
Yes, which is why we wanted to take out a little bit more of the fluid. So
Okay.
that's why they're pulling out
Dialysis.
a little bit more with the dialysis. And because his blood pressure drops when he has his dialysis, we've been
You can give him a little,
titrating the norepinephrine.
okay.
Yeah, so but these numbers are better now in terms of the norepinephrine requirement because
Okay.
they were a little higher yesterday.
Okay.
He had an earlier set of dialysis the night before when I was also on duty because he had some acidosis.
Severe. Is that the one we had severe?
Yes,
It was like
there was a
7.09.
7.0, yes.
Yeah, that's
So that's why we had an earlier run of his dialysis then.
okay.
But we've been able to address that a little bit, and that's why we're having his regular dialysis. We're now following the regular dialysis
Schedule. Okay. What is the regular dialysis schedule?
I think he's having it every other day,
Every
but
other day.
they're still adjusting now. So if he needs it every day, they adjust accordingly.
And then quick question about this: Are they
Yes.
he's in respiratory acidosis for sure, right? His bicarbs are
Yes.
low also though.
Yes.
Do they infuse any bicarb at that point?
Well, the dialysis is already has a bicarbonate
Okay,
bath,
cool.
so
Okay.
that's fine.
Okay.
And in between, they have been infusing some bicarbonate.
In between, yeah,
yes, in
yeah.
between the
Because his
dialysis.
bicarb from everything,
Yes.
the last ones, the bicarb has
Yes.
been low.
So I think it's really a renal problem, and of course because of the infection.
Both, yeah.
Now, with the CO2, the reason the CO2 keeps staying a little bit high is because the lungs are a little bit, how can I say, a little bit boggy with fluid.
Yeah. Okay.
So, if we take out most of the fluid with the dialysis, then the lungs are expected to also improve. But of course, gas exchange becomes a problem because of his the infection.
Yeah.
So, because of the accumulation in the CO2, that also drives the pH, the acidosis. So we have a mix
Both.
of both acidosis
Metabolic
and
and so it's a mix.
yes,
Yeah.
but the CO2 levels are a lot lower now. They were in the 60s yesterday, higher 60s yesterday. They're now in the lower 60s now, and we're also titrating to blow off. I have a repeat of the ABG after the dialysis is completed,
Okay.
so that we can see if we need to adjust the ventilator again. But for now, he seems to be doing better, and hopefully once the fluid gets most of the fluid gets pulled out, then we might see some improvement in the lung dynamics,
Okay.
in the static compliance, the blow off of the carbon dioxide. But
Okay.
otherwise, oxygenation wise, he's doing really well. It's
Okay.
just the CO2 retention. So that means there isn't much gas exchange happening. Palabas.
Mm-hmm.
We're able to
Bring
bring
the
oxygen
oxygen in
in,
here.
but the carbon dioxide
Yeah,
start
blowing
to
it out.
blow off. So, so far that's where we are in terms of the lungs. We had to sedate him because
He was
wasn't-
bucking the vent or something.
Yes, he was bucking the vent. He had ventilatory dysynchrony. We had him on rocuronium for a short while, about a day, but we didn't want to keep him off the keep him on the rocu because of course, the intrinsic weakness from the spinal cord injury.
Mhm.
So. We just ran it for about a day just so we could help the ventilator a little bit and help him with his breathing a little bit and blow off most of the carbon dioxide because it was higher in the days prior to the 60s yesterday.
Yeah.
So actually the 60s, much better in Napuyan. He had it in the 80s, I
Okay.
think the other day. So he's also on propofol and fentanyl. I had him on benazolam the other day.
Mhm.
I think that was Sunday.
Okay.
I had him on midazolam on Sunday, but because we wanted to help open up the airways a little bit and allow for a little bronchodilation, we shifted to propofol because that would help us with the heartbeat
Exactly.
pressures. So, hence the shift. And we wanted a quicker wash off when we eventually take him off the sedation.
Okay.
So you'll see it doesn't show a number now,
Mhm.
but if you see the lowest number, so that was in the 40s, 50s, ang target po the monitors.
Oh, okay.
Yeah. So the monitor, you see that there?
Okay.
Okay, so that's the bispectral index. It shows us adjunctive sedation. It was around 40. I think they just have to troubleshoot the monitor because I think it got a little loose.
Yeah, you got a
So
zero.
that lower number was in the 40s and 50s, which is about our target for deep sedation.
Oh, okay.
So he was in deep sedation and he's still in deep sedation. We haven't been adjusting any of the medications for sedation.
Okay.
Papatroubleshoot ko lang yan.
Okay.
It was showing numbers earlier. Blood pressure has been fluctuating, we mentioned that, so nag-adjust lang kami ng norepinephrine heart rate and oxygen levels are a lot better now. But as you can see, he's still breathing a little high.
Yeah.
Pero kung titignan niyo naman po, the minute ventilation is about 9.
Mhm.
So we're compensating for the low tidal volumes by giving him a little bit more breathing
Okay.
rate. So that you can still achieve yung minute ventilation ng about 8 to 10.
Okay.
Yeah, so pasok na siya, nasa 9. Hopefully that will still blow off the carbon dioxide, but I think it's more of a gradient
Mhm.
because he's not able to blow most of it off because there isn't any gas exchange
Yeah.
going on. Other than that, he's tolerating his feeding well. Wala pa tayong problema with the feeding. Of course, we had to hold off on any physical therapy
Yeah.
because of
Just
everything,
condition. Yeah.
But otherwise, he's a lot more stable now compared
To
to
2 days ago.
the
3 days ago,
past
yeah.
2 days.
Okay. So as the family, he's still guarded at this point.
Yes.
And he's had a couple setbacks. And my advice to my siblings is that they should still come.
Yes.
Yeah, at this point,
yes,
yeah,
yes. Just like we discussed
yeah,
last
yeah,
week.
last week,
I think,
yeah.
we spoke last week.
So I believe because there's no imminent thing.
No.
And
Hindi naman po.
and then really the other conversation that we had is futility. So we're not at that point. Are we at the point where
Not
there's
yet.
futility is
Not
involved?
yet.
Okay.
We probably had that.
Yeah.
We were there last week.
Okay.
So I was kind of worried that if the other family members
Yeah.
wanted to come home, yes, last week
Yeah.
was the best time to come home.
Yeah.
But right now we're we were able to pull him out of it.
Okay.
So some of the organ systems are now functioning a lot better than they were last week.
Okay.
But we're still not out of the woods. It's
Yes.
still a long,
Long process, but as a immediate, because there's two siblings, me and my brothers, and there's a,
dalawa lang po
yeah,
kayo?
there's three siblings, yeah.
Are you going out,
Okay.
Miss Lotta? Ah, sige po.
Okay.
Sige po.
Um,